Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Rousseau. We have an interesting and in-depth show for you tonight. We're talking about hand and wrist treatments and how our team of St. Luke's specialists can help. We'll be joined by a panel of medical experts from orthopedics and occupational therapy, hearing patient stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at hand and wrist treatments with St. Luke's University Health Network. Stay tuned. Thanks for joining us. Let's get started. We have a talented panel of guests joining us tonight. Up first, we have hand, wrist, and elbow surgeon Dr. Anastasia Newberry of St. Luke's Orthopedic Care. Dr. Newberry earned her medical degree at the University of Nebraska College of Medicine and went on to complete her internship and residency at Temple University Hospital in Philadelphia. Dr. Newberry completed a fellowship in upper extremity surgery at New York University Medical Center. Dr. Newberry's expertise include complex surgical reconstructions of both acute and chronic conditions of the hand and wrist. Her goal is to ensure that each patient achieves the best possible outcome that in most cases is non-operative treatment.
What drew me into hand surgery was the fact that we do a lot of our interacting with the world with our hands. We say hello, we give hugs, we grieve together, we give love with our hands. And so being able to return that ability to people was really important to me. So I do a lot of work in complex, both acute and chronic problems of the hand. Frequently people will come in with an acute injury to their tendon, allowing them not to move their hand at all. So what we do acutely is we fix the tendon and we try and get them back to moving as quickly as possible. A lot of people come in with carpal tunnel, which is something that everyone's heard about. This can be treated both operatively and non-operatively, and we see a lot of people with it. In terms of tendon problems, people come in with a lot of tendinitis issues, which again can be treated with steroid injections, bracing, and sometimes surgery. I believe that St. Luke's Orthopedic Care is the best choice of patients because here patients do really come first. It's not about the bottom line, it's making sure that everyone gets better. That doesn't mean that everyone needs surgery, but it definitely means that everybody needs the best care and the best personal care that we can give.
Dr. Newberry, thank you so much for being here.
Thank you for having me.
Of course, everybody fears not being able to use your hand or your wrist, especially in the smartphone age. Why is this so important, and what are you really looking for on injuries that you might be able to treat?
So what people forget is how much we do with our hands. Our entire interaction on a daily basis with our world has to do with our hands. Whether it's getting up in the morning and giving your loved one a hug, serving them breakfast, or checking that last-minute email before you head out the door. Patients come in and they experience either discomfort with daily activities or an acute trauma, and so we try and get them back to functioning without really thinking about their hands anymore. And that is when we know we've succeeded, once they can do whatever they need to do without thinking about it.
So important to get people back to their regular lives. Thank you so much for being here. Joining our panel next is Dr. Dante Palumbo, a hand, wrist, and elbow surgeon at St. Luke's Orthopedic Care. Dante received his medical degree from the Philadelphia College of Osteopathic Medicine and completed his internship and residency there, training as a resident in orthopedic surgery. During his time, he developed an interest for the detail-oriented and creative nature of hand surgery. Dr. Palumbo went into fellowship at the world-renowned Christine M. Kleiner Institute for Hand and Microsurgery in Louisville, Kentucky, where he learned advanced surgical techniques for the treatment of fractures, arthritis, tendinitis, ligament injuries, and nerve compression, as well as microsurgery of the nerves and vessels.
I always liked orthopedics because I always like building things, and as far as hand and wrist, I get to treat patients of all ages, and I get to work on all the soft tissues and all the bones as well. Some of the most common things I see are nerve compression injuries such as carpal tunnel. We also see things such as trigger finger, tendon injuries, things of those nature. I think people take for granted the use of their hands, especially now with telephones and any kind of mobile devices. You'll see frequently patients at a younger age tend to have more pain and more problems with their hands as they're using mobile devices more. Getting patients back to what they were doing before, whether it's work or playing with their grandkids, couldn't be more gratifying. You want to spend as much time enjoying life as you can, so that the short time they spend with us is really giving them their lives back. I think St. Luke's Orthopedic Care is the best choice because it's a very family-oriented approach. So it feels like a family when you're treating the patients. Everybody gets to know the patients, and the patients generally give us that feedback when they're completed their care.
Dr. Palumbo, thank you so much for being here.
Thanks for having me.
What is unique about hand and wrist surgery, and how do you determine when someone needs surgery?
What's unique about hand and wrist surgeries is the hand and the wrist are very complicated. There are multiple things working simultaneously between the tendons and the ligaments and the bones. It's a very complex system. Surgery is necessary when we exhausted all conservative measures. We try many non-operative treatments to see if that will help, and then surgery is the last resort.
Well, certainly I know people would like to avoid surgery, but certainly they're in good hands if they have to have it.
Absolutely.
Thank you for being here. Let's meet our final panelist, Chris Latchford, a certified hand therapist with physical therapy at St. Luke's. Chris received his Bachelor of Science degree in occupational therapy from Temple University in Philadelphia and achieved distinction as a certified hand therapist from the Hand Therapy Certification Commission in 2001. He currently serves as the clinical coordinator of hand therapy for physical therapy at St. Luke's. Chris treats patients with all types of conditions or injuries to the hand, wrist, and elbow, including tendinitis, and sees patients following surgery. Chris's treatment focus is manual therapy, and he also specializes in Mulligan mobilization.
I think that basically most therapists want to go in to help people. Our patients that come in come from a couple different sources. A lot of them are referrals from our hand surgeons. I do see a decent amount of athletes. Often there'll be athletes with collateral ligaments of the elbow for throwing sports. We do see some athletes with tendinitis. It's satisfying to get the end results of people getting back to function, resuming their active lifestyle. We have a great staff. They're very compassionate. We make sure that we have a good rapport with our patients and our physicians that refer to us. So when things aren't right, we have easy access to our docs, and the communication is very essential to good outcomes.
Welcome, Chris. Thanks for being here.
Thank you.
Can you tell us what it means to be a certified hand therapist, and what does that offer patients?
Certification in hand therapy is a distinction that a clinician has worked at least 3 years and 5,000 hours in a hand setting. Once you achieve status of certified hand therapist, every 5 years you need to have 80 hours of continuing education focused on hand therapy.
It's really an incredible level of certification, knowing that you've got great expertise. What do you think this offers your patients?
Well, one, it offers the patients confidence that we have experience. It gives our doctors the confidence that we have experience to see their people that they're sending to us. And it's the highest standard of care that we have.
Excellent. All right, so now we've got a little bit of a better understanding of what all of you do, but there's so much. As Dr. Palumbo mentioned, this is a very complex part of our body, and we want to learn more. So we'll be back right after the break, and we're going to dig a little deeper into what conditions can be treated at St. Luke's. Stay tuned. You're watching St. Luke's Health Now.
I loved cheerleading so much that I sort of neglected the pain I was experiencing that led to an injury. I started cheerleading in 6th grade and I continued all the way through my freshman year of college. I've always had the pain in the left wrist and I always thought it would go away, and I just sort of ignored it. It wasn't until about 2 years after I stopped cheerleading until I realized that it was still hurting, and I knew that this was probably going to be a long-term injury, and that's when I knew I should probably get some help. I knew I wanted to go to St. Luke's because they have a really good orthopedic program. First thing that we were going to do was try to do physical therapy just to see if that could help heal the pain I was experiencing. After 6 weeks of therapy, we realized that the pain was still there, so that's when we decided surgery would be the right option for me. Post-surgery, I'm feeling really good. The pain has reduced and I'm keeping up with the occupational therapy at home, and I'm just so happy that I got it done, because if I would have ignored it, it could have gotten a lot worse. I would highly recommend St. Luke's for any orthopedic surgery you may have, because they really care for you from beginning to end.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being with us and for providing us questions, which we're going to get to later in the show. Joining me is an important panel of medical professionals, Dr. Newberry, Dr. Palumbo, and Chris Latchford. We've started to discuss the basics of hand and wrist care. Now we want to get a better understanding of what conditions and what kinds of things you guys are seeing at St. Luke's. So Dr. Newberry, I want to start with something people talk about all the time, which is arthritis. What is arthritis and how often are you seeing it?
Arthritis is probably one of the most common things that walks through our doors. Arthritis is basically a degenerative condition, whether it is in an inflammatory state or because of chronic use of the joints of the hands. As a person moves through life, what happens is you get some stiffness in the joints, particularly worse in the morning, and people will come in complaining about this. When you have arthritis, little simple tasks become more difficult. Now, certain types of arthritis are more common in certain types of patients. Now, when it comes to wrist and hand arthritis, the treatment algorithm is very similar. We begin with non-operative treatment. Generally, we try anti-inflammatory medications, occasionally oral steroids. If those things fail, we move on to steroid injections if patients can tolerate them, bracing, occupational therapy to strengthen the muscles and the tendons around, so the supporting structures of the joints. And if necessary, we can do either reconstructions, so arthroplasties, or we can fuse the joints, take the joints away. That allows the joint to no longer move, but it also becomes less painful.
So there are so many treatment options I hear that you try before. And now, of course, I'm thinking about how often I'm pinching something during my day. Dr. Palumbo, in addition to arthritis, what are some other conditions that you commonly see people come in with affecting the wrist, the hand, and in your case, maybe the elbow?
Some of the more common things we see are related to overuse. Tendinitis about the thumb, about the fingers, also about the elbow. Also common things such as carpal tunnel, which is a pinched nerve at the wrist, or cubital tunnel, which is a pinched nerve at the elbow. They're very common things we see with overuse. Frequently we try conservative measures, but ultimately they may need surgery for those type of things.
Is there any efforts being made for people to just sort of slow down that use, or is some of it just difficult to avoid?
The nice thing with hand and wrist patients, they're very motivated. They're coming in because they want to get back to what they were doing. So typically they want to try some treatments, try to, instead of limiting their activity, they want looking for an intervention.
Well, speaking of other treatments, Chris, they come to you often, and tell us a little bit about how do you evaluate a patient and what they might be experiencing to set up what kind of treatment options you're going to do in PT?
So evaluation starts with their subjective complaint, and that's the reason they came in to see the physician, and that's the reason they're sitting in front of us. After we do that, after we take their subjective, we start to assess them. We palpate to see what areas are sore. We check motion, we check strength, and we look at what activities they struggle with and why are they struggling with them. Then we formulate a plan of care, which includes addressing lack of mobility, lack of strength, inability to do activities, maybe adapting the way you do something for the arthritic or the person who has an overuse syndrome from doing things with improper technique. We'll brace people at night. We'll do custom splints at St. Luke's.
You mentioned activity, Chris, and so Dr. Newberry, I want to ask you a little bit about the weekend warriors and the sports-related injuries. A lot of times people think that that often affects the ankle or the knee or, maybe a concussion when you're talking about sports. How often are you seeing hand and wrist sports or weekend warrior-related type activities?
Surprisingly, very frequently. A lot of the time, especially in the fall season when there's a lot of throwing sports, and so football, we have a lot of ligamentous injuries about the fingers. Now, some of those can result in obviously fractures, which will take a player out for the season if they need to be treated surgically. However, a fair amount of things that happen around the fingers and the hands with weekend warriors and athletes alike is that they will get ligamentous sprains in the fingers and the small joints of the fingers. Now, when treated appropriately, they can actually get back to play fairly quickly as long as they've regained motion. Unfortunately, a lot of the time when we don't see people or they try to push through and they get really stiff, that's when Chris has to come in and make sure that they get their motion back.
Well, you mentioned about kind of when they get treated. Dr. Palumbo, how important is it if someone's experiencing pain or has experienced some sort of injury that they come and see their physician quickly or an orthopedist?
It's very important. A lot of times people are working and they feel like they have to work and get through their job in order to provide, so they tend to ignore their injuries. Same thing with athletes. We take care of people of all ages. I have many high school athletes that they just want to play, so they're simply, they're playing through the whole season and they tend to wait and they tend to have more difficult problems to treat. So it's very important to get in and get the problem addressed so you're not dealing with problems later.
Right, don't ignore it, and it takes longer to heal possibly. Well, when we get back from the break, we're going to talk a little bit more about communication and technology and the role they play in hand and wrist therapy at St. Luke's. We'll be back in just a moment. You're watching St. Luke's Health Now. Stay tuned.
The reason I became an occupational therapist, my best friend was diagnosed with leukemia when he was 5. He passed away at the age of 16, and he was always willing to help others. And I promised him that I would do the same as him in my daily life, and I thought occupational therapy would be the perfect way to do that. The types of patients I see are hand, wrist, and elbow patients, before and after surgery, after trauma, and to help them treat pain that they experience in their daily lives. We're able to provide active range, active assistive range, and passive range of motion for any joints that they're experiencing problems with. Occupational therapy is about treating the whole person, not just their injury. And I consider myself a lifelong learner, and that's exactly what you kind of do with the hand, wrist, and elbow. It feels really great getting people back into their daily lives. It's really one of the reasons that I went into occupational therapy. The staff here is really caring and honest and always willing to help. They're super motivating kind of when you're down. Even if you have a bad day, you know you're gonna not end up having a bad day kind of working here. The staff's always uplifting and positive, and we all get along super well. The reason I would recommend people to St. Luke's is St. Luke's provides specialized care. If you're coming in, we want you to see the best people, and those people are those who specialize and know the most about their field.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we've had a fascinating show tonight. We're talking about treatments for the hand and wrist. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Newberry, Dr. Palumbo, and Chris Latchford. Thank you all for being here. In the first part of the program, we talked a little bit about the basics of hand and wrist care, but now we're going to get into your specialties a little bit deeper. So Chris, I'm going to start with you. You specialize in manual therapy. Can you tell me a little bit more about what that is and specifically how it's beneficial to patients?
Manual therapy is basically hands-on techniques. We specialize in joint mobilization, soft tissue mobilization, scar mobilization. We use instrument-assisted tools that we can use for different techniques. I personally specialize in mulligan mobilization, which is a joint correction to relieve pain and allow the joint to move at the same time, which often gives good pain relief and increases motion for a person who's stiff.
Speaking of advancements, Dr. Palumbo, can you tell me a little bit about some of the surgical techniques that are being used today, specifically microsurgery?
There are a lot of new techniques in hand, and the nice thing at St. Luke's, it's a teaching institution. We have orthopedic residency, so it keeps us up to date. Things that is not tolerated well in the hand is scar tissue and swelling. So we're moving to a lot more minimally invasive techniques, more arthroscopy in the hand, similar to shoulder, and we're able to do scopes in the small joints of the hand. Other techniques we're doing with hand surgery is actually keeping the patients awake using regional anesthesia or local anesthesia, keeping the patients awake and being able to do the procedures so they can get started moving right away.
Wow, that's really incredible. Dr. Newberry, you were talking a little bit about arthritis earlier in the show. If left untreated, can that lead to carpal tunnel syndrome? And if you have carpal tunnel, what sort of treatment options are available at St. Luke's?
So arthritis does not necessarily lead directly to carpal tunnel, but it certainly can. Arthritis meaning, the degeneration of certain joints within the hand, particularly in the wrist, can lead to some deformity, and the deformity causes a structural abnormality which can decrease the space allowed for the nerve within the carpal tunnel. Now, compression of that nerve, which is what everybody knows about, called carpal tunnel syndrome, is that numbness, that tingling, that sort of awkwardness in the hands that we always aim to treat. The initial therapy for carpal tunnel, we always try to manage things non-operatively. We begin with nighttime bracing, which corrects the position that the wrist rests in at night to try and alleviate some of the compression of the nerve. Next, we move on to either oral steroids or injected steroids to try and decrease some of the inflammation around the nerve and allow it to function better. Now, if all else fails, we have to do what's called a carpal tunnel release, which is either done endoscopically or in an open fashion to release the compressive ligament that lies on top of the nerve.
But certainly something that should not be ignored because you do have so many treatment options.
Absolutely.
Chris, I'm going to jump back to you for a second. We often hear the term trigger finger. What is that, and do you have ways to help patients deal with that kind of pain?
We do. A trigger finger is when your finger, the flexor tendon, gets a nodule and it catches, and the fingers have a pulley system. And what happens is as it flexes, it pulls through the pulley and gets caught. Early symptoms will be stiffness, progressing to clicky feeling, and then to locking. The earlier you come in for a trigger finger, the better the conservative options are. We can make little splints that will prevent that joint from moving and allow that area to calm down. We do manual treatments on that as well. Early treatment can include injections from the physicians.
Dr. Palumbo, often people are afraid to go be seen because they are concerned about having to get surgery. You mentioned earlier some of the techniques. Where do you see the future of technology heading for minimally invasive surgery, I guess to alleviate some of the fear of people getting help in the first place?
I think the future, especially in hand surgery, is definitely more minimally invasive, more smaller incisions, and more patients getting surgery wide awake with local anesthesia, getting them moving quicker. I think in the past we'd immobilize patients longer, waiting for them to heal, and we found out they just stiffened up more. So getting them moving right away, smaller incisions, and more advanced techniques to get patients are more satisfying.
It is pretty amazing how quickly patients are being asked to start moving right after surgery. Dr. Newberry, you specialize in complex surgical reconstructions for both acute and chronic hand problems. Can you tell me a little bit about what those types of issues may be that you're seeing in patients?
Sure. One of the things that we often see, and is something that is only really treated by hand surgeons, are flexor tendon injuries. So the flexor tendons of the hand allow us to grasp things and grab. Unfortunately, if you suffer a laceration or a cut to those tendons, the problem becomes that they do not heal themselves, so you have to have it surgically fixed. In the acute setting, it's a surgery that requires a lot of finesse because you're working basically through the pulley system that Chris described, and you're trying to shuttle tendons back and forth and repair them in a way that they don't create a lot of scar. Now the problem becomes is that people always think, it'll get better, and sometimes when they present to us, the problem is now the actual pulley system has degenerated, and so you're looking at an 18-month process where now you're recreating the pulleys and then bringing in harvested tendons in order to make up for the ones that have been lost.
Dr. Newberry, you're talking about things that are very complicated often and require a big team. So Dr. Palumbo, how important is the communication across the team and across the network for patient care?
It's extremely important. Like Chris had mentioned, the communication with the therapist, with everybody that's seeing the patient, it's really a 360 type of care. The surgery part, our part is a couple hours in the OR, but for the patient it can be months afterwards of therapy. And staying on top of that, staying current with the patient, see how they're doing is very important.
Thank you all for this innovative and important information, but we're not done. Up next, we're going to take questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding group of panelists. We've had a good conversation about hand and wrist treatments at St. Luke's Orthopedic Care. Now we're going to take some questions from our viewers. Are you ready? I'm going to throw this out to the group. What is more beneficial to help decrease general finger joint pain? Working on mobility or working on strength?
Yeah, I would say you were going to figure that out during the assessment and what the source of the pain is. If it's stiffness, then mobility is going to count. But if it's from a muscular imbalance where the one side of musculature is stronger than the other side, correcting the imbalance will help with reducing pain there.
Okay. The next question is, do you often do finger joint replacements?
It really depends on which finger joint it is. Because it is such a small area rather than a knee or a hip, we really have to be conscientious of the force that goes into that joint and what we want that joint to do. Now, when it comes to the thumb, as we talked about previously, the base of the thumb, we do a lot of reconstruction. It's basically like a joint replacement, but rather than using metal and plastic, what we do is we use tendons to reconstruct a sling and reconstruct that joint. We can replace other joints in the hand, especially the knuckles, the MCP joints, with silicone implants. When it gets to the fingertips or the DIP joints, the very, very little guys, the problem is that the implants are just too small and don't hold up well. So there we prefer to actually do what is called an arthrodesis or a fusion of the joint rather than a replacement.
So sort of a follow-up to that, what non-invasive approaches would be used when every joint on every finger is affected with arthritis?
Typically, with conservative measure with arthritis, steroid shots can be very effective. We all have patients that we've injected, and the pain relief can last for months. with the small joints in the finger. We like to keep patients moving, so therapy will also help. But steroid injections with severe arthritis tend to be very effective.
Speaking of steroids, we do have a question that says, what are some of the risks that come from taking steroids or having injections?
So anytime steroids get a bad rep, and I think that's because people don't distinguish between the different types of steroids. So the steroids that a bodybuilder would use, an anabolic steroid, is completely different from something that we would use in the office. Short courses of oral steroids can be very beneficial in inflammatory conditions, whether it's an arthritic joint, a tendinitis that just won't go away. And as long as they're kept to a short period of time, the detrimental effects are pretty limited. Now, long-term steroid use, which for some people is unfortunately unavoidable, can lead to significant issues with both their adrenal function or their hormone function, in addition to weakening bones. But we, as orthopedic surgeons, really try and limit the duration of our steroid use. In terms of joint injections, we really try and avoid doing them more frequently than, say, every 3 months for joints. And generally, we do not do repeated multiple injections into tendons, as that can actually lead to tendon degeneration and potentially tendon failure. So in those cases, we limit it to maybe 1-2 injections for the tendon, and then if that doesn't work, then we move on to more invasive options such as surgery.
Okay, thank you. Is TENS and EMS effective for tendinitis, and are there devices that you can use at home that are also effective?
TENS is a electric stimulation system that blocks pain. It will help with pain relief, where you can block the signal of pain so that if it's a wrist tendinitis that it doesn't hurt, but it's not curative. And tendinitis, to cure tendinitis or improve tendinitis, requires addressing why you're getting tendinitis. Tendinitis usually happens from overuse or incorrect use of a body part where you're getting more wear. So addressing those problems is the first step in correcting a tendinitis.
I have one last question. Dr. Palumbo, what is it that you want patients to know who might be experiencing any kind of pain in the elbow, the wrist, or the hand about coming to see you or anyone at St. Luke's for care?
What I would want them to know is that there is an answer for them. There is a solution. No one should have to go to work in pain. No one should have to suffer through their weekend with their grandkids in pain. There are many different conservative options that we have to treat pain. Patients shouldn't think they're going to be rushed into surgery when they come to St. Luke's.
Excellent. So great for people to know. Thank you so much for your insight and your wisdom and sharing it with all of us here today. And thank you to our audience for some excellent questions. We all learned so much. For more information on hand and wrist treatments at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well and remember it's important to focus on your health now.